Hi.
My name is Amanda. I'm going to be your nurse today. We're going to do a little assessment here and make sure everything's good. Can you name your name and date of birth for me?
It's Tara, 4/24/1976.
Okay, we have an alert and oriented 36-year-old female. She has no behavioral issues. Her hair is neat and clean. Her clothes are well kept. Her speech is clear. We're going to do a hearing test here with a tuning fork. Hearing seems to be normal per the gross whisper test and also the Ryan-Weber test. This makes sure that your hearing is okay. We're also going to check your vital signs, so I'm going to listen to your apical pulse if you don't mind. Apical pulse is 70 and regular. We're going to check your blood pressure. Blood pressure is 132/76. Temperature. Your temperature is 97.9, which is normal. We have 16 respirations in easy. And can I have a finger? Your oxygen saturation is 98% on room air, which is great. So your skin seems to be warm, dry, and pink, so that's great. We also have, do you have any open areas, sores, or lesions anywhere? Good. Let me check your nail beds. Nail beds seem to be pink. Capillary refill was within normal limits. Do you drink enough fluid?
Yes, I do.
Okay, well let me see here. We're going to check your skin turgor. Skin turgor is within normal limits, so that means you probably have no signs or symptoms of dehydration. Next, I think we're going to check your pupils and do a little bit of a neurological exam. Can you look straight at my nose here? Good. Pupils are equal and reactive to light. There's no damage to the sclera or the conjunctiva. We see no scratching or redness. We're going to do what's called a 6 fields of gaze. So don't move your head, just follow my pen, up and down, then to the side, to the other side, down and down. Great, perfect. Also, we're going to have you do a few things as far as up and walking and moving around. If I give you my fingers here, can you squeeze these for me? Good. That is to test your muscle strength, and your hand grasps are equal. They're about a 5 on the muscle scale. Can you push up on my, now down? Those are also strong and within normal limits. Can you stand for me? We're going to turn to the side here. I want to check your back. We have no scoliosis, which is a curvature. We have no kyphosis, which is a humpback, and we have no lordosis, which is an in the bottom there. Can you do some heel-to-toe walking for me? Perfect. This shows balance. Now can you stand? I want you to close your eyes and put your arms out to your sides straight. Here we're looking for swaying. This is the Romberg's test. With the swaying, we would have problems with gait or balance, but we do not. So that is great. Can you move your arms up and down like this? Good. That's good range of motion. Any swelling, edema, or pain in any of your joints? No, perfect. Okay, you can have a seat now. Okay, now we're going to listen to your heart, your lungs, things like that, okay? So first of all, I want to check to make sure that you have, it looks symmetrical here. We have no barreling of the chest, also symmetrical in the back. Your respirations are easy, so that's good. I'm going to listen here. We have 10 spots on the front and 20 on the back that we're going to do. So we are going to start here. We're going to go deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Perfect. Now can you lean forward for me? I'm going to listen to your back. Okay, deep breath. 1, 2, 3, and 4, 5, and 6, 7, and 8, 9, and 10, 11, 12, 13, 14, 15, and 16, 17, 18, 19, and 20. Good. Your lungs sound good. No problems. Your chest rises and falls well. Breath sounds are within normal limits. Here we will be looking for such things as crackles, which could mean CHF or congestive heart failure, or also anything like a wheezing noise or anything that could be asthma. Next, we're going to assess the heart sounds. Heart sounds, we do 5 different ones. We are going to start on the right side. Excuse me. We have the aortic, which is the second intercostal on the right. The S2 is louder here. We have the pulmonic, which is the second intercostal on the left. S2 is also louder here. We have Erb's point, which is the third intercostal on the left. These are equal S1, the love dub is equal here. We have the the tricuspid, excuse me, which is the fourth intercostal on the left. And then we have the mitral, which is the fifth intercostal on the left. That all sounds good. The mitral valve is where we would listen for things like pleural friction rubs and murmurs, which you don't have any of, so that's great. So now I think we're going to check your lymph nodes. This is for cancer or masses or any kind of issues, or sometimes infection, stuff like that. So we're going to check here. Okay. And we're going to check under here. Okay, that's good. Next, we're going to check all of your pulses to make sure that you're getting adequate blood flow everywhere. So we're going to check your carotids, which is here and here. We're going to check your brachial. That's good. We're going to check your radial, which is on your thumb side. And then we're going to check your ulnar, which is on your pinky side. Next, we're going to check your femoral and your groin. We're going to check your popliteal, which is behind your knee here. We're going to check your posterior tibial, which is on the back of the ankle, and your dorsal pedis, which is right here on the top of the foot. Those all seem fine. You're getting great blood flow everywhere. Have you noticed any swelling or any edema in your feet? Okay. So no edema in the bilateral lower extremities, but if there were, it could be 1 to 4, and it could be non-pitting or pitting. There's one other thing we want to check for as far as your heart goes, which is called jugular vein distension. So if you could lean back at a 45-degree angle, your jugular veins run here. We want to make sure that they're not bulging or anything like that, because that could indicate fluid overload. But yours look good, so we're good there. Next, we're going to look at all of your gastrointestinal stuff. Is there any way you can open your mouth and stick out your tongue for me? Good. Mucous membranes are pink. They're moist. Teeth look in good condition. No gums bleeding. We're going to inspect the abdomen now. The abdomen is flat, non-distended. Is there any pain in here? Okay, we have no rebound tenderness. We also need to listen to the abdomen to make sure that the bowels are moving like they should be. We're going to listen to the right upper quadrant first. We can listen up to 5 minutes to hear a gurgling noise. That is good. And then we're going to go to the right lower, and then the left upper, and then the left lower. Everything sounds good there. We also would feel on the abdomen and percuss to hear whether we would hear tympani, which would be a sound that would be like a full of air sound, or you could hear a dullness, which is like a fluidity. It would feel like it sound like a fluidity, but you don't have that, so everything's good. Also, we're going to palpate the liver and the spleen to make sure we don't have any masses or any edema, looking for cancer, things like that. Are your bowels moving okay?
Yes, they are.
When was the last time you had a bowel movement?
This morning.
Great, great. Have you noticed any kind of issues with your urination?
No.
You're going enough times a day? The color, there's no odor or anything like that to that? No. You're not having any problems starting or stopping?
No.
Okay, perfect. You don't have any distension up in the upper abdomen. This doesn't hurt up here at all. So no bladder distension noted. Now finally, have you been doing your self-breast exams?
Yes, I do that.
Oh, okay. You need to do them in a warm shower and usually 1 week after your menstrual cycle. Okay. Well, everything checks out great, and hopefully we'll see you back soon. Thank you. I don't know which one to push.
Push the...
This one?